So I'm Eugene Braunwald, and I am a professor of medicine at Harvard Medical School, and I work at the Brigham and Women's Hospital in Boston. We have been experimenting with updates, and we've been experimenting with companions, and there's still more work to be done on both of those. I think that working with Debra Beck, who is a very talented writer, who has a very good feel for what doctors want to know and how much they want to know and how much they need and care about. She has a good intuitive sense for that, and then with some focus groups, it became interesting. So for the updates, I selected what I thought were the most important papers published during the course of the preceding month or two. Well, that's not what people wanted. They wanted something even more recent than that. And that deals with the pressure to stay up to date. So she came up with the idea of hot off the press. Everybody recognizes that term, and what we have worked out is a system with the major journals whereby we see the tables of contents while they are still embargoed. And obviously have to respect that, because the moment that we make a mistake, we'll get cut off. So, but we've been very good about that. So, you know, for example, I know what's going to be published in circulation 6 weeks from now, and she gets the material once it's set into typeface. So we have gone back and forth about a hot off the press article before it ever goes on press. So I think that's one. Then I also felt that beyond, you know, late-breaking news, so we have late-breaking clinical trials, which people are always interested in, like at this meeting. Hot off the press, what is coming along? What do you want to know the day it appears in the New England Journal? But the key thing is not to have those things floating in thin air. They have to be attached to a specific page, to a specific paragraph, so that somebody making it a living textbook to say, well, okay, we're going to read about a field called aortic regurgitation, and here's the basic information. But in the past 2 years, there have been 3 new papers on treatment changes, and therapy changes more rapidly than anything else. I think that's been pretty popular. And then obviously cardiology is an ever-expanding field, and that's why we have the companions that can grow into greater detail. Now, just in the past couple of months, since the companions are online, Debra has been attaching her articles not only to a page in the mother book, but also to a page in one or more companions. We had an article recently that appeared in 3 companions, so that if you buy the companion, you're also buying into that, and there's very little extra work involved. Another thing that I've been working on are focus reviews. So supposing a new field, it's not an article, it's not a trial, it's not a late-breaking clinical trial, it's not a single paper, but there is a movement in the field. For example, you know, there's a lot of interest now in using heart valves inserted on a catheter. instead of surgery. So that's attracting attention. And so I've had a review article of that. Now that wasn't there. It was there in the most primitive form only a year ago when the book came out. And now it's coming out. It's now widely used. So now if you pick up the book, you will find a new section of that. So there's various ways of imparting information. So I feel a lot about information. That's what we're making available. That's what we want to provide. There's this old saying that the railroads went under because they were focused on railroads. They weren't focused on transportation, but transportation changed. The railroads were the dominant form of transportation in the second half of the 19th century. But once the motor car came along, it changed. And once airline flight became feasible, it changed again. So I think we have to change. The information is always going to be coming, but we have to present it in a way that is up to date and is exciting and interesting to our audience.
My name is Debra Beck. I'm a medical writer. I write the updates for Braunwald's heart disease. Originally, we just had one kind of update, and it was just a summary of a recently published journal article. Dr. Braunwald picks the articles that he would like summaries of. In the last several years, we've expanded that, and we have several different categories of updates in the book. There's hot off the press updates. Those are recently published journal articles. We try to get them summarized and published online within 10 days of their being published in the journal. We also have late-breaking clinical trials. Those are sessions that are presented at the major meetings like the AHA and the ACC, the European Society of Cardiology, and those are picked by Dr. Braunwald. Summaries are written and they're posted online. And now we're actually posting, along with those late-breaking clinical trials, slide decks from the presentations. We also put the late-breaking clinical trials into the companion editions. So all of the Braunwald companion books are updated based on the presentations from the meetings. Updates are posted almost every week online, sometimes a couple of times a week. And we post anywhere between 10 or 12 and 20 updates a month. In the months where there's a major meeting, then that might increase to 30 updates a month. Well, in cardiology especially, the field is changing so quickly that, even though the Braunwald's heart disease is published every 3 or 4 years in its print version, if we don't update it online, it'll quickly become dated. There have been studies that have been presented at major meetings that are practice-changing studies, and they change practice right away. The guidelines might change within 6 months of when a new drug is approved, or a landmark study has shown that a new drug is efficacious and safe. And we've tried to keep Braunwald's up to date with that. So we also will write updates based on approvals, approvals of major drugs, FDA approvals. You know what, it's been an honor to work with Dr. Braunwald all these years. It's a lot of fun when I meet him at the major meetings, and medical students and residents kind of come up to him and ask him to sign their books. He's really a rock star at the medical meetings. He's an incredibly gracious man, really wonderful to work with, really wonderful. I really don't like him fixing my typos, but other than that.